And we are back with Issue Today and reporter Angela Chung. Good morning, Angela.
Good morning, Sunyan.
Happy Monday.
Happy Monday.
And we are going to start off with some good news because visiting policies for nursing hospitals and facilities have been eased or will be eased starting tomorrow, right? So people can soon visit their family members.
Right. Starting tomorrow, in-person visits will be allowed at nursing facilities and nursing hospitals across the nation if the patient is in severe medical condition or one requires the permit from doctors who take their primary care. So face-to-face visits to those facilities have been banned since last March of last year amid the concerns over the spread of COVID-19 infections. Central Disaster and Safety Countermeasures Headquarters announced that it will revise visiting policies for these nursing hospitals and facilities so that in-person visits will be allowed not only for those who are about to pass away, but also for those who are in a severe condition equivalent to unconsciousness, or if the primary care doctor agrees that the patient needs the visits for their emotional stability.
Like you said, it's been almost a year now since these face-to-face visits were limited. And of course, these policies are closely linked to the social distancing policy and level for the general public, right?
Right. Since last March, only contact-free visits have been allowed at nursing facilities and hospitals when the social distancing level is at 2 or lower for nursing hospitals. As the nursing facilities, contact-free visits have been allowed when social distancing level is at 2.5 or lower. So in-person visits have only been allowed when the patient is at their deathbed.
This is painful, of course, not only for the patients, but also family members who have been really wanting to visit them in person. Not quite the same, right? These contact-free visits.
Yes, people who have family members at those facilities have expressed they're going through a painful time because many nursing hospitals and facilities put a ban or limit on visits altogether. And that made the government step in to ease their visiting policies. And I personally remember not being able to see my grandfather last fall until one last time when he was basically at his deathbed.
Oh, I'm sorry to hear that as well. Okay, so these visiting policies are being eased, but I'm sure there are still going to be some strict guidelines in place for those who do want to make these in-person visits?
Yes, in-person visits will be made in one-person bedroom or in a separate place, and visitors must wear personal protective gear and be tested for PCR test within 24 hours from the date of visit. Or they must have tested negative from a rapid antigen-based test, also known as 신속 항원 검사. So the government added that they will carry out policies on contact-free visits as well by clarifying the standards for these visits.
And I understand we also have an update on the Pfizer vaccine. It's been approved for those aged 16 and older.
Yes, Ministry of Food and Drug Safety held a final review committee where they announced that they will approve community product Pfizer's COVID-19 vaccine. It has been concluded that Pfizer vaccine has passed the verification process twice, and it is now safe and has 95% effectiveness in preventing the infection in a clinical test with those who age 16 or older. This new brand name community has been coming in by a separate route from one imported through COVAX facility, and the amounts of vaccines for 13 million people have been signed with Pfizer.
Right. I know this was the first time that I heard of this name, Community, and our listeners might be kind of curious about this too. It's basically the new brand name for the vaccine made by Pfizer and BioNTech. And I don't know if you know how they came up with this, but it kind of brings together community, immunity, mRNA. All these words are kind of mashed up together, and that's how community. I think we're going to become much more familiar with it going on. All right, let's move on to our next item. You're going to be introducing us a new measure that's aimed at internet-based content creators.
Yes, Korea Communications Commission plans to carry out ethics education to internet-based content creators, including YouTubers, in response to content issues on the internet. The commission explained that there has been an increase in provocative and violent content on the internet as the number of one-person media market expands recently. And there have been growing voices that the countermeasures should be taken against the dysfunctions such as diffusion of unverified information on the internet. The Commission's project titled Build Sound Ethics Culture on Cyberspace, announced on 7th of March, placed weight on ethics education for creators, preventing violence on cyberspace, and AI ethics education in preparation for post-COVID-19 period.
Okay, so you just gave us a little overview on why they felt the need for this. Can you tell us in more detail about this ethics education?
Sure. To explain more details, the Commission will make and distribute a guidebook that contains cases and guidelines that creators can actually use when producing and running their contents. The Commission will also provide customized education to creators to help them develop a sense of ethics and the ability to monitor and correct themselves.
Right. This is actually not the first sort of measure that has been introduced by the Commission, right? It's been coming for the past couple of months.
Right. In February, the Commission put in place guidelines to prevent creators from signing unfair contracts with multi-channel networks, also shortened as MCN, to place focus on preventing users from getting affected in negative ways. The guidelines include enhancing fairness of contracts between MCN and the creator, protecting creators who are minors, banning improper and exaggerated advertisements, and so on. And in June of last year, the Commission released guidelines for protecting children and adolescents who appear on internet-based content.
Right, all very necessary, of course, as the reach and influence of internet broadcast grows and grows. Moving on to our last item, I know that a lot of people, myself included, I'm not sure of you as well, we take a lot of health supplements, don't we? Like vitamins, ginseng, probiotics. I'm sure you take a couple too?
Yes, I love red ginseng.
You love it. Okay, good.
So the Ministry of Food and Drug Safety conducted a survey on 1,500 adults, both female and male, in November of last year, and found that 68.9% of the respondents bought and are taking health supplements. In 2017, the rate was 60.6%, and in 2018, 63.6%, and 67.6% in 2019.
Steadily rising, and I'm sure with the coronavirus, a lot more people are paying attention to their health. So it's been increasing annually, but I also do wonder that whether these decisions are sometimes based on reliable sources. I understand you have some tips of maybe words of caution even when consumers are thinking about buying some of these supplements.
Whenever I need some or want some, I always spend at least half an hour searching for the right one on the internet and comparing a lot of different elements. 33.7% of the survey's respondents said they purchased it based on recommendations from their acquaintances, while 24.4% said they bought it after they saw ads on the internet. As for the awareness level of the contents, 70.9% said they are aware of how they're different from general food, and 74.9% said they know the certified mark designed of the product they purchased.
Certified mark design, that's quite important, isn't it?
Right. The Ministry of Food and Drug Safety asked people check if the product has been certified by the ministry before they buy health supplements. So certified products have health functional food mark along with the certification design logo, good manufacturing practice, shortened as GMP, certified design on the container or surface of the product. So one needs to be extra cautious if you're on a medical treatment or taking any medication. The ministry also advised that if you have any abnormal symptoms after taking any, stop taking it and consult with a doctor.
Very good advice. Thank you very much, Angela. We'll see you again on Friday.
See you on Friday.